Good morning, ladies and gentlemen. Welcome back to the course on physical medicine and rehabilitation in sports. This is the last week, and we hope you have gained a lot of knowledge and expertise over the past 7 weeks. This week, we will try to sum up whatever we have learned over the past 7 weeks. And today, in lecture 1, I'll be discussing the principles of injury prevention in sports. I'll be covering this topic as per the following outline: introduction, objectives, epidemiology, risk factors, principles and modalities, prevention, recent advances, and as always, we will conclude with a take home message. Injury prevention in sport is very, very important to enhance athlete performance and for longevity in sport. If there are multiple injuries during the athlete's playing career, his performance will go down and his or her longevity in the game will also reduce. There is a large impact of injuries on athletes' careers, well being, and overall quality of life. We should know something about the key injury prevention strategies which will help to reduce injury risk, and if they cannot reduce the injury risk, at least they should be able to reduce the injury severity. The objectives are to understand the fundamental principles of injury prevention, to explore the risk factors contributing to sports injuries, to discuss evidence based strategies for injury prevention, and to highlight the role of technology and innovation in injury prevention. Epidemiology. Injury rates vary across different sports. It depends on whether the sport is a contact sport or a non contact sport, whether it's an individual sport or a team sport, whether it is an event which takes place in summer, whether it's an event which takes place in winter, whether there are teammates involved, whether there is equipment involved. All these factors have a bearing upon injury rates. And that is why injury rates do vary across different sports. When you are part of a sporting team, you must be aware about the statistics about injury rates relating to your particular sport and your particular team. There is a difference in acute and chronic injuries in different age groups. And there may be some commonality, but we must be aware about this epidemiology, how it affects the different age groups. We should be aware about the tracking of injuries and the analysis of the injury data in particular relevance to injury prevention. As we have already seen, there are several intrinsic and extrinsic risk factors for injury. The intrinsic risk factors are age, gender, muscle imbalances, previous history of injury, flexibility, biomechanics, and neuromuscular control. The extrinsic risk factors are playing surface, equipment, environmental factors, overtraining, and improper techniques. We should understand these risk factors, and we should also be aware about a predisposed person and an inciting event, which we have already discussed in the injury prevention model. If you understand these factors, it will help you to tailor make better injury prevention programs. Warm up and cooling down techniques. Very, very important in the role of injury prevention. Dynamic stretching is required before activity, and static stretching should be done after the activity. Dynamic stretching helps to prepare the body for activity, and static stretching helps in reducing the waste products of metabolism. Stretching also improves the muscle elasticity and reduces injury risks. Sport specific warm up and cool down routines must be followed because warm up and cool down has to be tailored to the specific sport, to the specific athlete, to the sex of the athlete, to the age of the athlete, etc. Strength and conditioning programs. There is no doubt that proper, well designed strength and conditioning programs have a big role in injury prevention and in performance enhancement. We must follow the principles of overload, periodization, and functional training. If we are unable to do so, we should take the help of a qualified SNC coach or trainer. Please note that we should not forget the importance of core stability and balance exercises while preparing the athlete for sport. Flexibility and mobility training. Proper mobility and flexibility reduces the stress on joints and muscles and helps to prevent injuries. We have discussed the role of static versus dynamic stretching and their applications in injury prevention. There is a strong statistical relevance of foam rolling and active release techniques in injury prevention and importance in the enhancement of recovery. There are several papers which have dealt with this, and foam rolling and active release techniques should be a part of your cooling down. Load management and recovery. Again, we have discussed the concept of acute to chronic workload ratio and its impact on injury prevention. We should always remember the importance of rest and recovery periods and should not only focus upon the training and the training loads. There are several tools for monitoring the training loads, such as heart rate variability and GPS tracking, and we should be aware of all of them. And more importantly, we should be using them intelligently. Proper techniques and skill development. There is a very important role of biomechanics in reducing injury risk. Biomechanics play a role in assessment as well as in correction of movement abnormalities which may cause injuries. We may have to develop proper coaching strategies for reinforcing proper technique and sport specific drills that enhance movement efficiency and safety should be practiced in all training programs. Nutrition and hydration for injury prevention. Macronutrients such as protein, carbohydrates, and fats are important in tissue repair and recovery. We should not forget the role of micronutrients also. They are also important in recovery. Hydration and fluid strategies are important to prevent heat related illnesses and muscle cramps. There are now several new nutritional strategies which help to reduce the inflammation and to promote injury. Nutrition and hydration is a modality which is commonly overlooked in the strength and training and sports training world. And it should not be overlooked, and in fact, it should be brought to the forefront of the sports injury prevention program. Psychological factors in injury prevention. There is a strong risk between mental health, stress, and injury risk. Because of this strong risk of mental health, stress, and injury, we must teach the athlete cognitive behavioral strategies for improving focus and resilience. There is a good role of sports psychology in maintaining athlete motivation and well being. Sleep and injury risk. We all know that if we have not had a good night's sleep the previous few nights, we are groggy, we do not have good muscle coordination, and we have balance and cognitive issues. So, we should be aware of the impact of sleep derivation on cognitive function, reaction time, and muscle recovery. We must teach the athlete proper sleep hygiene tips to enhance athletic performance. And we must know the relationship between adequate sleep duration and injury occurrence. We need at least 8 to 9 hours of sleep every day for proper recovery. Protective equipment and gear. Helmets, braces, footwear, all equipment which the athlete is going to use for the sport should be properly fitted. And nowadays, even the mouth guards and the footwear are tailor made. There are new technology which is coming in, such as impact absorbing materials and custom orthotics and mouth gear for the protective gear. And these technologies should be used judiciously. Make sure whatever equipment you have has undergone proper regular maintenance. And prior to each event, make sure the equipment is checked for safety. Playing surface and environmental considerations. If you have an astroturf, or if you have natural grass, if you have clay, if you have sand, there is a difference between the surfaces, and there is a difference in the injury patterns which are seen in different playing surfaces. So you should be aware of what the athlete is playing on, whether it is a synthetic surface or it is a natural playing surface. Heat, humidity, altitude, cold. All these environmental factors have a strong bearing on the injury risk and should be catered for. And preventive strategies should be looked into and practiced. Make sure your field and courts are properly maintained to reduce the hazards of play. Injury prevention in youth athletes. There are several unique injury risks associated with the growing bodies due to the growth of the bone, muscle, tendons, and the ligaments. We should encourage multi sport participation in young athletes, and we should encourage late specialization for a particular sport. Make sure we follow all the guidelines for age appropriate training and competition loads. The training load and the competition load should be based upon what is called biological age, and biological age verification should be part of the pre participation physical evaluation for all athletes. ACL injury prevention programs. These are very common mechanisms for ACL injuries, and ACL injuries are more common in females. We have seen this several times in the past lectures. We should implement neuromuscular training and plyometric drills for ACL injury prevention. There are several programs such as FIFA 11 Plus and PEP program, which are successful injury prevention programs in several different sports, and we should be utilizing these for our sport. Concussion. Again, another important aspect which the athlete, the coaches, and the parents should be educated about. All the symptoms of concussion should be told and should be watched out for by the parents, the athletes, and the coaches. We should teach the athletes proper tackling and contact techniques to minimize head injuries. And we should use techniques such as impact sensors and contact assessment tools to improve our diagnosis and management of sports concussion. Overuse injury prevention. We should be able to recognize common overuse injuries such as stress fractures, tendinitis, shin splints, etc. And we must deal with the importance of rest, training variations, and cross training to prevent these overuse injuries. We must have proper strategies for modifying and varying training intensity and volume. Periodization and recovery strategies. We must have a structured training cycle to prevent burnout and injuries. Proper periodization and proper recovery time is important and should be factored into the training programs. We should use active recovery techniques such as cryotherapy, massage, and hydrotherapy if we cannot give time for passive recovery. And we should be monitoring regularly the athlete readiness for sport with subjective and objective measures. Pre participation screening and assessments. The role of musculoskeletal screening in injury risk identification is very, very important, and we have seen this over the past few lectures. We should use FMS and other diagnostic tools for pre participation screening and assessments. We must also use the team doctor and use his or her expertise to perform regular medical evaluations and baseline testing by the exercise physiologist. Role of coaches and support staff in injury prevention is very important, and we should be educating our athletes about injury prevention. We must create a culture of safety and injury awareness. And we must ensure that the training loads are proper and the recovery strategies are well tailored to the sport. Return to play protocols. We must have proper steps to safely reintroduce the athletes to sport after an injury, and it should be a proper scientific based protocol with the help of the team doctor. Importance of progressive loading and monitoring for signs of re-injury should be done even after the athlete returns to play. We must assess the psychological readiness to return to play and then only return the athlete to play. There are several advances in injury prevention technology. We are using wearable technology to track the athlete's load and movement. We are using AI driven injury prediction models, which are based on biomechanics and training data. Virtual reality and augmented reality applications are being used increasingly for rehabilitation and training. There are several challenges in injury prevention implementation. People are not compliant. There is a lack of resources in the grassroots level, that is, youth and amateur sport. And there is a need for individualized prevention strategies based upon sport and athlete characteristics. Please note, this is manpower intensive and requires a lot of qualified and highly skilled manpower. So, what is our take home message? Injury prevention is a multifaceted approach involving training, recovery, equipment, and psychology. There is an important role of continuous education and adherence to evidence based practices in injury prevention. And future innovations will further improve injury prevention and athlete safety. These are the references I have used. Ladies and gentlemen, I strongly urge you to go through them in the interest of better understanding. I have finished, ladies and gentlemen. Thank you so much for listening. Thank you and Jai Hind.